6 types of headaches, causes and treatments. Welcome to Health Living UK, your go-to place for pain relief tips, healthy food ideas, and overall well-being. Have you ever been hit with a headache so bad it ruins your entire day? What if I told you that not all headaches are the same, and understanding which type you have could be the key to finally getting real relief? From the common tension headache to the excruciating cluster headache, today we're breaking down the 6 main types of headaches, their causes, and most importantly, how to stop them in their tracks. Stick around, because this information could change the way you handle headaches forever. Headaches. We've all had them. That sudden nagging pain that creeps up when we least expect it, making even the simplest tasks feel impossible. But did you know that not all headaches are the same? In fact, there are 6 primary types of headaches, each with its own unique causes, symptoms, and treatments. And understanding them could be the key to finding real relief. Let's start with one of the most common culprits: tension headaches. If you've ever felt like there's an invisible band wrapped around your head, squeezing tight, you might have experienced a tension headache. These headaches are often triggered by stress, anxiety, poor posture, or even dehydration. They bring a dull, aching pain that spreads across the forehead and back of the head. Unlike migraines, tension headaches don't usually come with nausea or visual disturbances, but they can still be a real nuisance. So what can you do about them? The good news is that tension headaches often respond well to simple lifestyle adjustments. Staying hydrated, practicing relaxation techniques, and maintaining good posture can work wonders. Over-the-counter pain relievers like ibuprofen or acetaminophen can help. But if these headaches are frequent, it's worth looking at stress management strategies like yoga, meditation, or even a simple daily walk. Now, let's talk about migraines, perhaps the most dreaded type of headache. If you've ever had one, you know exactly why. Migraines aren't just a headache, they're an all-encompassing experience. Throbbing pain, sensitivity to light and sound, nausea, and even visual auras can make migraines completely debilitating. What causes them? Well, the triggers vary from person to person, but common ones include hormonal changes, certain foods like chocolate and aged cheese, lack of sleep, and even weather changes. The treatments for migraines go beyond simple painkillers. Many people find relief through prescription medications designed to reduce the frequency and intensity of attacks. Lifestyle changes such as maintaining a consistent sleep schedule, managing stress, and avoiding known triggers can also make a huge difference. Some even turn to alternative therapies like acupuncture or magnesium supplements, which have shown promise in reducing migraine frequency. Cluster headaches are another type, and they're often described as the worst pain a person can experience. These headaches come in cycles, or clusters, hence the name. They typically strike around the same time every day for weeks, or even months, before disappearing for a period. The pain? Intense, excruciating, and usually focused around one eye. Sufferers often feel restless, pacing the room or rocking back and forth, desperate for relief. The exact cause of cluster headaches isn't fully understood, but experts believe they are linked to abnormalities in the hypothalamus, the part of the brain that controls our body clock. Unlike other headaches, over-the-counter painkillers don't usually help. Instead, treatments like oxygen therapy, prescription medications, and even nerve-blocking injections can be effective in shortening attacks and reducing their frequency. Sinus headaches, on the other hand, are often misunderstood. Many people who think they have sinus headaches actually have migraines. But true sinus headaches are caused by sinus infections, which means they come with other symptoms like facial pressure, nasal congestion, and sometimes even fever. If you have a headache that feels worse when you bend over, and you also have a stuffy nose, there's a good chance it's a sinus headache. The best treatment? Addressing the underlying sinus infection. decongestants, nasal sprays, and in some cases, antibiotics can help clear up the infection and, in turn, the headache. Rebound headaches are a lesser-known but incredibly frustrating type. Ironically, they're caused by the very medications people take to relieve headaches. If you rely too much on painkillers like ibuprofen, acetaminophen, or even caffeine-containing medications, you could end up in a cycle where your body actually triggers more headaches as the medication wears off. The only real way to break the cycle is to stop taking the offending medication, which can be tough in the short term but necessary for long-term relief. It's always best to consult a doctor before making any drastic changes to medication use. And finally, there are hormonal headaches. These affect women more often than men due to fluctuations in estrogen levels. Many women experience headaches before or during their menstrual cycles, during pregnancy, or even while using hormonal birth control. The good news: lifestyle changes, certain prescription medications, and hormone balancing therapies can help manage hormonal headaches effectively. Keeping a headache diary to track patterns and potential triggers can be a useful tool in finding the right treatment approach. So what's the takeaway here? Headaches are not one size fits all. Understanding what kind of headache you're experiencing is the first step to finding relief. Whether it's making simple lifestyle adjustments, seeking medical treatment, or identifying and avoiding triggers, there's always something that can be done. If you're experiencing frequent or severe headaches, don't just suffer through them, seek help and take control of your health. And remember, knowledge is power. The more you understand about headaches, the better prepared you'll be to prevent and treat them effectively. Stay healthy, stay informed, and take care of yourself. Thanks for watching Health Living UK. Don't forget to like, subscribe, and hit the bell for more health and wellness tips.